Namaskar. Hello everyone. Welcome to yet another episode of Bright Talks by Pacholi Aesthetics and Wellness. I'm your host, Dr. Divya Aggarwal, Head Process Development and R&D, Pacholi Aesthetics and Wellness. And today, on World's Heart Day, we have a very special guest with us, Dr. Subhash Kumar Sinha, Senior Cardiac Director and Cardiac Surgeon in Max Super Speciality, Saket. Namaskar, Doctor.
Namaskar, Dr. Divya.
We are delighted to have you here. And for those who have joined us for the first time, Bright Talks by Pacholi Aesthetics and Wellness is an initiative in public interest, wherein our founder and mentor, Dr. Preeti Seth, has taken an initiative to spread awareness about various medical practices and to debunk the myths associated with it. And today we have Dr. Sinha joining us in this initiative. And we will be discussing various aspects of heart health. And I'm sure our viewers are very eager to learn more under your kind guidance. So, Doctor, since it is World Heart Day, I would want to understand from you, since there are a lot of heart attack cases increasing these days in young individuals, what are the factors contributing in it?
The most important thing what we say as factors is we have to understand that there may be factors which you can modify and there are some factors which you cannot modify. For example, your age, an increasing age is a risk of cardiac disease, especially coronary artery disease. Your family history, that is, talks about your genes. These are unmodifiable factors, but there are certain very important modifier factors, like if you smoke, your chances of having a heart attack is very high. If you have diabetes which is uncontrolled, if you have high blood pressure which is uncontrolled, these are the factors which are very high chances of having a heart attack. Then comes your activity. A sedentary habit person has an increased propensity to have a heart attack. So these are factors which you can modify. Alcohol, everybody asks whether alcohol intake is also a big factor for having a heart attack. Surprisingly, alcohol in moderation does not increase your risk of heart attack. But if you overindulge, that is a sure shot reason for having heart problems. The most important thing is most of the people with alcohol will also smoke and have a good amount of high cholesterol food like chicken fry and fish fry and all those things. So that has to be avoided. If you are really in to protect your heart, it's advisable to take wine, which is a less alcohol containing drink, and at the same time top it up or have it with salads.
So that's a very insightful information about Dr. Sinha. So we all know now that lifestyle plays a significant role in heart health, and let's explore more about it. But before that, I would request all viewers to throw some love by tapping onto the heart button. So keep showering your questions and keep commenting so that we can take up all the questions in the end of the session. So Doctor, is stress also an impact on the heart health? Can you throw some light on this?
Well, definitely stress does play a very important role in that. But if you ask me, in today's world, who doesn't have stress? The children have stress because they have to perform, and especially the parents pressurize them to perform well in their school, so they have stress. The adults, because of increased tension at their workplace, they have stress. And when you keep on going up the ladder in a corporate sector, you have a lot of stress. It is important how well you handle stress, and that is the most important thing, where stress, if you de-stress yourself, take some holidays, go out for outings, have some friends, do some yoga. These all will calm your mind and the stress will go off, or rather it will reduce.
Okay, so that means these stress management techniques, what doctor has suggested you, will play a significant role in maintaining your heart health. And now, doctor, so modern diagnostic have transformed the heart care. So, can you throw some light on the latest advancements and their impact on the healthcare provider or the professional, and how it is beneficial to the patients as well?
The most important thing is understanding that what you need. If you are suspecting that you have a coronary artery disease, the basic thing is not that you get an ECG and say my heart is all right. The thing is you have a treadmill test, what we call as a stress ECG. Treadmill test is a design test where you walk on a treadmill and you have a continuous ECG recording. If they keep on increasing the speed, with that you can very well see whether you have heart changes or not. If your treadmill is normal, no need to go further for your investigations. In quite a few places like army and then there's bureaucrats, they have a treadmill test every 2 years, that is a screening test. If the treadmill is positive, then the next stage comes as getting an angiogram. Either you get a CT angiogram or a regular angiogram. Nowadays the angiogram is done by the radial artery route that is from the hand. So the time when you had a femoral angiogram is gone, where you had to keep your legs stretched for quite some hours, and that was quite uncomfortable. With radial route, you can have an angiogram and go back to your work within an hour or two and keep on doing the same thing there. Now, once suppose you have got an angiogram which is positive or there are blockages, you have various methods to treat it. Further, you can have your heart assessment by stress thallium. Whether if you have lot of blockages, then we also need as a surgeon to know if we are operating, whether it is going to be beneficial for you. We just don't want to subject you for surgery because you have got blockages and you do not have symptoms. If you have a symptoms, we put some grafts, your symptoms will go off. So these are few modern things what we have got and change the thought process of every individual. CT angio also is a very important screening tool. I do not consider that as a diagnostic method because that can give you a rough estimate as how much is the blockage. But if you want to have a treatment as well as diagnosis, a regular angiogram is the answer.
Fascinating insights, doctor. So for those who have joined us now, this is Bright Talks by Pacholi Aesthetics and Wellness, and I'm your host, Dr. Divya, and we have with us Dr. S.K. Sinha, and we are talking about your heart health. So, doctor, genetics also plays an important influence in heart health. So, what do you have to say about it? What proactive steps the family should take if they know that they have a genetic influence?
Well, genetic influence, you cannot change your genes. This is what everybody says.
Yeah.
But suppose I know that my father was a young heart patient, coronary artery disease. I'll take precautions, I'll keep my things like I'll indulge into exercise. If I have a diabetes, I'll keep it under control. If I have hypertension, I'll take medicines for that and try to have a low cholesterol food so that I also do not develop a heart disease in the very young age. Now, if you ask me, I have operated a large number of patients where I have operated on the father, I have operated on the son and daughters, I have operated on brothers continuously, 2-3 brothers from the same family. So this keeps on going. You can say that the family eats the same food, so that must be a very important thing. Yes, I agree, but genetics is also important.
Okay, thank you so much, doctor. It's really insightful. So we all know, as the doctor has said the family eats the same food. So that means nutrition is the key to health. So, sir, there are any important nutritious health food for healthy heart? I mean, which you would like to emphasize on, since you've already communicated that wine is moderately okay for people if they want to consume. So, similarly, what healthy food people can take?
But most of the healthy foods people don't like. So,
So,
if you have to eat healthy food, try to keep your oil intake as less as possible.
okay.
Like suppose you go and a better thing is to have a grilled chicken or a grilled fish rather than have a fried chicken or a butter chicken and all those things. Then the most important thing, the amount of fruits and vegetables what you consume. It's very important that you consume a large amount of fruits and vegetables. It is said that you should have at least 5 portions of fruits and 5 portions of vegetables every day. The other thing is that if you are, and everybody of us takes cholesterol in the food, that should be in a minimum. Here I would like to emphasize that people think that taking too much of milk does not have cholesterol. They have. So too much of milk is also not very good, especially what I'll call it as a buffalo milk, and especially things which we keep on slow fire, making it thicker. That is probably not very good for your heart. Similarly, it comes for sweets. Too much of sweets is also not very good. In moderation, everything is good, but don't overindulge.
Okay, so that is a fantastic advice. So doctor has said and emphasized that 5 fruits and 5 vegetables one must take, and buffalo milk and milk should be also in moderation. So please watch for it. And doctor, wearable tech is gaining popularity these days. Not only in India, globally people are using Fitbits and the watches. So what is your say on this?
It's very important because we have got gadgets where you can wear it and it gives your blood sugar, how much is the blood sugar at a present time. So you can keep a very close check on your blood sugar. Then the smart watches tell you how much you have walked on that day. And if you have done 10,000 steps, it's very good. Similarly, you can watch your blood pressure with the help of the watch, heart rate with that. So it's quite helpful for your own monitoring. But then if you are health conscious and you have to lead a healthy life.
So is it, doctor, safe and accurate, these Fitbits?
Most of these gadgets are pretty accurate, and I don't see that there's any reason you should not use it.
Okay. Thank you so much, doctor. And since the cases are increasing for heart attacks, so what are the recognizing signs one should watch for crucially so that they can understand the warning signals?
2 things here I will emphasize. Most of us know what is a heart problem, or you can say something which you feel that you are having a heart attack. Angina, what we call, or what the medical terminology says, is the cry of less blood into the heart. So if there is a disproportion, that means there is a blockage there and the heart muscle is not getting enough blood. You have a crushing type of feeling behind the chest bone, that is somewhere here, and the moment you stop, that thing goes off. Again, when you start walking, after some distance, you get that feeling. That's a classical angina which is described. That pain can radiate in your arm, in your neck, in your jaws. Sometimes the patients also have something called a toothache, or what we in Hindi call as a daant mein sihran hoti hai. That is also one of the features of angina. But here I would warn you that a huge amount of patients come to us, I have got a gas problem, which actually is not a gas problem, it is an angina. And they keep on taking antacids and a lot of pan 40, pan D, everybody knows all these medicines and they keep on swallowing that. But actually what they are having is a heart problem. So if you have got a gas problem which is not getting remedied with all these medicines, antacids and all, do consult your doctor, and it is important that you get an ECG and a treadmill test done before you can label it that yes, I am completely, it's only gas, not a heart problem. The third thing is difficulty in breathing. A lot of people get difficulty in breathing, or they have a problem when they are doing an unaccustomed exercise. That is, you are climbing stairs every day, say 2 flights of stairs every day, and suddenly you realize that when you are walking in the second flight of stairs, you are having difficulty in climbing it and you become breathless. That's a warning sign. Please do look after your heart, get a doctor to examine it and do a treadmill that will give you the answer.
Very important information. Now you have the signs and symptoms which you can watch for. Do not keep popping the antacids. Please consult your doctor in case you have any kind of a gastric condition which you're experiencing regularly, and also if the pain is radiating in your arms or tooth, so do not ignore it. So we all know exercise is vital, and even in a busy schedule, exercising is important. But how much to exercise? Is it impacting your heart? Since we now hear people who were gym goers and gym lovers, they are also experiencing heart ailments. So let's understand what is the right thing when it is exercising. So doctor, what is your take?
See, this very important thing is that what we call as aerobic exercises. Like if you are walking, if you are running, it is okay. But suppose you are not running and walking every day, and suddenly you decide to have a 100-meter dash. That is not good for you. If you are walking on the treadmill every day at say a particular speed, and suddenly you start increasing it when you had never done it before, that can lead to a problem. What happens? All these gym trainers and all, they train the people, but they are themselves not doing exercise every day. So sometimes what happens, just to show their prowess or something, they do something which is they are not accustomed to. They can have a problem. So it's not that doing gym is harmful or doing running is harmful, but you have to train yourself to do that exercise, and that is very important. So it's not that exercise is harmful. It is that you have to be regular in that. Don't do it suddenly. That's my advice.
So on World Heart Day, doctor, what is the message you would want to give to our viewers to convey them and inspire them to take better care of themselves?
It is very important that as you grow old or as you age, in your 40s and 50s, I'll ask you to even do jogging or running or some, maybe once you are going for a walk for 4 kilometers, you can do another half a kilometer of running or jogging, what we call. And if you want to go in for some, say, Delhi half marathon or so, you can have a training for at least about a month and then go and run it. You'll be all right. As the age grows, if you keep on doing running, jogging, maybe the heart will be all right, but you'll start getting some pain in your knees and all. So my advice is still 60, 65 years of age, if you are running, it's okay. But slowly come down on your running and do more of brisk walking. That will be more helpful for you. But if you do not have any bone problem or any joint problem, you can continue running. I have seen people running at the age of 70 and 75 and they do well. There is no issue in that. Now coming to how much should you exercise? Should you walk only 5 kilometers or you can go up to 8 kilometers or 10 kilometers? My advice is you can do whatever comfortably you can do. If you can do 10 kilometers, it's okay for you. If you can do 5 kilometers, 6 kilometers, but at least do something. That is my advice. And especially young people who are developing paunches and means increasing their weight, going up to 90 and 95 kg, reduce your weight, because that is going to harm you in the long run.
That's an important and wonderful message. So anybody who is obviously obese, must watch for the weight, and it is important to exercise. So, doctor, there is a lot of discussion about calcium and its impact on heart health. So, can you clarify, is calcium good or is it bad? Can you explain the role of calcium in arterial calcification?
Well, arterial calcification, it's not that you pop calcium and that goes and gets deposited into the arteries. That's a myth.
Okay.
What happens that you have got an atherosclerotic disease where the atheromatous plaques get deposited into your arteries, and if you are in a higher age bracket or there is inflammation, the calcium can get deposited there. So, coming to how much calcium you should take, well, the daily requirement is finished by your normal food intake and a little bit of milk and all. As your age goes up, maybe 65 plus, then your body has got less adaptability, so that you need vitamin D and calcium supplements. Below that age, if you ask me, I don't think everybody should be keeping and taking calcium tablets, because that's of no use.
So that's a wonderful, valuable insight, doctor. So there is a common belief that heart attacks are more likely to occur during the early morning hours. So is it true? Is there any relationship between heart attacks and the time that it tends to happen?
Well, quite a few people do have that problem when they have a heart attack early in the morning. The other time when they have more of a heart attack is towards the evening when they come back from work. The early morning is related to our endocrine system and your stress system. The adrenaline surge occurs during that time, roughly about 4 or 5 o'clock in the morning. So it happens because of that. So not exactly you can have a heart attack anytime, but usually the early morning problem is there.
Okay. So, doctor, we have heard a lot about water therapy and its overall benefit to the health. So, what is this water therapy and what are the potential benefits it holds?
A lot of people have got this notion that if they drink too much of water, maybe 8 to 10 liters, the system gets flushed. If you have a heart problem and if you are prone to go into cardiac failure, do not increase your water intake. If you are healthy, your kidneys are healthy, if you drink 4 or 5 liters of fluid, it's okay. But it is not going to benefit you much. That if an adequate amount of water is roughly about 3 to 3.5 liters, that should be sufficient. During summer months, if you are working outside in the field and you are sweating too much, then you take more. But otherwise, more than 3.5 liters somehow doesn't benefit us.
Okay, so now it's time to take some questions, and for those who have joined in, we are here on the Bright Talks with Speciality Aesthetics and Wellness, and we have with us Dr. S.K. Sinha, who's a senior cardiac surgeon, and we are discussing about heart health. So can we just see a question? So doctor, people are saying to be speaking little Hindi, so let's take the questions in Hindi only.
That's no issue.
Yeah. Okay. So, Doctor, Veronica is asking, which is good to lose weight, gym or yoga or diet? क्या choose करना चाहिए, gym, yoga या diet?
You have to cut down on your food. That's the main thing. And then whether you walk or do yoga, everything is the same because it's form of exercise. Even gym, if you are too much of weight, initially you do legs exercise, go on the treadmill, do some bicycle there, and slowly you lose weight. Don't try to lose weight very fast. It doesn't work, because if you lose weight very fast, that is going to come back to you again.
Okay.
So diet also is very important. You have to cut down on your diet.
Okay. So doctor, one of the viewers is asking, heart care tips for people who smoke and who do not want to quit smoking. So,
that's a difficult question because
any safe limit?
There is nothing like a safe limit in smoking. probably you don't know that nicotine causes a spasm of the coronary arteries. Even people who take this tobacco, they chew tobacco, they are also very prone to having a heart attack. And there are enough examples where the people have stopped this chewing tobacco and their angina has disappeared. So if you ask me, there is nothing like I will smoke also and I do not want to have a heart disease. Well, if you are lucky, you can keep on smoking till 80 years of age and nothing happens, but depends on your genetics.
Okay, so thank you so much for all the engaging questions, and today it was World Heart Day and we thank Dr. S.K. Sinha for his kind presence, and here we are wrapping up. There are a lot of questions, but we will all take it up in the comment section and in the DM messages. So it's time to wrap up now, and my heartfelt gratitude to you, sir. Thank you so much for sparing out time. And we will meet you in the next episode of Bright Talks with Pacholi Aesthetics and Wellness. And it is World Mental Health Day on 10th October. So catch us live on that day with your host, Dr. Divya Aggarwal. Thank you so much. Namaskar.
Thank you. Namaskar.